talking about doping in the Olympics. Pyle, bring us up to date.
Yeah, so this is complicated, Mike. So this is a drug that is typically used to treat a condition called angina, which is blockages in the blood vessels. And it's actually a drug not available here in the US, available in Europe. And what it does is it changes the way that your heart metabolizes fatty acids and sugar. So it makes the heart more efficient. It makes it work better, and it can increase endurance and stamina. And the controversy here is, how did a 15-year-old Russian figure skater end up having a positive blood test for this drug that is really only for people that have advanced angina or blockages in their arteries?
Wow, read the rumor that maybe she and her grandfather got confused about some medicines. I mean, is that plausible? I mean, what's it look like? It could be confused with other things.
I'm finding that a little hard to swallow, to be honest, because she says she shared some water with her grandfather, and that may be how the blood test that came out positive for her was actually contaminated, because she shared some saliva with him inadvertently. Even if she had drank water that had the pill actually dissolved in it, I would have to say it would have to be a large amount of water for her to test positive. And she likely may have had some side effects, because it's not a medicine that she's used to having. So she may have noticed that something is off. So I'm having a little trouble sort of wrapping my head around the accidental contamination causing her to test positive. But Mike, I think the interesting question is whether her testing positive back in December, knowing that the drug is out of your system after about a couple of days, still affected her performance now, making her eligible for, winning Olympic medals.
Should she be allowed to compete?
Absolutely not. In my opinion, I mean, as an athlete, she has to be held to a higher standard, just as we do as physicians, And while she's performing, she should have been extremely careful what she put inside. But I also think it is entirely plausible, even though the drug itself is out of her system, if she had been taking it for some period of time before, or had been using large doses of it, it could have affected her ability to train and given her a competitive advantage over the other athletes who perhaps were not using it.
Well, Pyle, thanks for joining us. And thanks to all of you for joining us here today at Snackable Health.